Thank you for tuning in to PCTV. Welcome once again to PCTV Health Talk Show. Today we are coming to discuss a very interesting and life-changing topic. But before we start, I want to give most big thanks to the Almighty God for making today a success. I want to give a very big thank you to our mama for bringing PCTV to life. Mama, Apostle Mrs. Dennis Ajima Prempe, I say God bless you. I want to give another big thanks to our papalistic papa for being the pillar of PCTV. Mr. Benjamin Ajima Prempe, God bless you so much. As I said today, the topic is going to be interesting and life-changing. I want to give a big thanks to our sponsors for sponsoring this show and bringing this show to a success. We want to take a brief commercial break. We'll be right back.
Heard there was a secret chord that David played and it pleased the Lord. But you don't really care for music, do ya? Well, it goes like this: the fourth, the fifth, the minor fall, and the major lift. The baffled king composing hallelujah. Hallelujah, 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 hallelujah.
As I said earlier, we are discussing a very interesting topic today. Today we are talking about esophageal cancer. I know a lot of people have heard of esophageal cancer, but they don't know what the condition is. So today in our studio, I have my very own friend, an old friend. She's a professional nurse and a health advocate. She's in the person of Madam Elizabeth BOTCHWAY. Auntie Lizzie, welcome to PCTV. Thank you for honoring our invitation.
Thank you too. Thank
How
you
are
for
you
having
doing?
me. I'm fine. I'm good.
Thank God. I've seen a lot of things you are doing online, and I must say it's nice.
Thank
Keep
you.
it up, keep it
Thank
up,
you.
keep
Thank
it
you
up,
so
keep it
much.
up. So for people and our viewers who don't know you, who haven't seen you before, I want you to tell us something brief about yourself.
Okay. First of all, good afternoon, good evening, wherever you may be watching, and I'm glad to be here. You know, I'm always glad to share the little knowledge I know about health to people, so that they'll be able to take good care of themselves. At the same time, you and I, our workload at the hospital will reduce. Yeah, so I'm always glad to, reach out to people. And of course, my name is Elizabeth. Just like you mentioned, I'm a professional nurse and also a founder for the Nurse Pal. It's on all social media, so please go and follow me. All I do is to give out the little I know about health. And also I work at International Maritime Hospital as a professional nurse. So I think for now, that's okay for now. Thank you for having me once
Interesting.
again. Yeah.
Interesting. So today we are discussing esophageal cancer. A lot of people have heard of esophageal cancer, but they don't really know what the condition is about. So can you please briefly enlighten us about the condition?
Okay, so thank you once again. Before I start with esophageal cancer, it's an aspect of cancer. I would like to talk again because I remember I've been here for like about a few months ago. I talked about breast cancer
Yeah,
also, forgotten years, and I gave a general concept of cancer, and I want to see that again. So cancer is a growing concern. The numbers keep rising, and then prognosis is nothing to write home about. So it is something that is out there. One thing that people overlook when it comes to cancer is that they think it's limited to major organs. We know the stomach cancers, the lung cancers, breast cancers. That's what people know. But I want to tell them today that cancer can affect any part of the body. That is why today we've picked an aspect of it, which is the esophageal cancer. But we have skin cancers, yeah. We have throat cancer, we have stomach cancer, we have a lot of type of cancer, and they are all the same. Now, let me take us back a bit. When you look at our body, God made it in a special way that we have cells in our body. They are tiny cells, they grow, they they perform whatever function they are supposed to perform, and they die off. New ones has to come. Okay. Now life happens, just like as we move around, life happens. The cells, they are very tiny. They can just multiply abnormally to form a lump. It can be biological, which is internal factor, which the body is, being the cause of it. We have risk factors too that increase your chance, not necessarily, causing cancer, but increase your chance of you know, getting cancer. So these tiny cells sometimes multiply abnormally and they form a lump. You might not know when the process starts, but we are advocating, or we are preaching out that when you see any signs, come to the hospital. Now that lump is what we call tumor. That doesn't mean you have cancer. It can be benign, it can be malignant. Okay. Now, whatever I've explained can affect the throat. That is why we are saying throat cancer. So with throat cancer, we have, of course, cells in the throat, which can also go through abnormal proliferation and form that tumor there that can block the esophageal tube, what we call the food pipe where food passes. So it can happen that, the esophagus can block, and then it will prevent you from a lot of things. Now, when you look at the risk factor, aside the biological factors, the internal factors, the risk factors, it's cut across. Most of the cancers have the same risk factors. We are saying that it will increase your risk, not necessarily causing. One example is people who drink alcohol. You see those who drink alcohol, somebody will tell you that I've drunk alcohol for like 20 years, but I don't have cancer. Somebody who just went for a shot and it has triggered. Aside you having the cancer-causing agents, the BRCA1, BRCA2 within you, sometimes you inherit those genes. These risk factors, you are saying that can increase your risk. So people who drink alcohol a lot, people who smoke, people who don't like exercising, okay, there are other risk factors to exposure to radiation and all that can increase your risk of those cells being multiplying to form that lump. Yeah. So this, a general information about esophageal cancer. I don't want to move ahead of you. I know probably you might have a lot of questions. So let's end at the risk factors. So these are generally what increase your risk. We are still making a research. We don't have a single proof or cause that we can, like a primary cause. We all know that malaria, of course, if mosquito bites you, we know where it's coming from. But when it comes to cancer, we cannot tell that this is the main cause of cancer, but we look at other factors that comes to play to cause it. Yeah.
So, viewers, as you've heard, cancer can affect every part of your body, from your head to your toe.
Yeah.
Any part of your body is really at risk of developing cancer. Therefore, we have to take very good care of ourselves. We know we always hear about breast cancer, cervical cancer, prostate cancer, and all of that. cancer can affect all parts of the body. I'm sure people don't even know that cancer can affect the esophagus. So today there we are coming to learn a lot of things, a lot, a
I
lot.
know, right?
And Madam Lizzie, I want to know some of the common signs and symptoms that somebody will go through to know that, oh, this thing that is happening to me, it means that I have esophageal cancer or something. But today we'll have to mix the language.
We'll mix it back because
because not all of my viewers understand English.
okay.
No,
Okay.
mene antina wakagawa
No problem.
so that those who don't really understand the English would also benefit from what we are
That's
saying.
fine. That's
So
fine.
could you please tell us some common signs and symptoms of the
Okay.
esophageal CA?
So when you look at signs and symptoms of cancer in general, they kind of look alike. But because this one is, we've limited it to the throat, alomega. Because we've limited it to the throat, let me say something that, of course, we all know that the esophagus connects the throat and then the stomach. You know, and it's a point where before it gets to the stomach. Okay, so of course it's a food pipe. That is where food passes through. So one of the commonest signs, and I share so yeah, say no, whatever is happening there. Sometimes I don't want to say you have cancer. Yes, I almost say obi to me many there, but I say I many cancer. No, please. We are not saying say whatever I'm coming to talk about. If it happens to you, means that you have cancer. No. So one of the signs is difficulty in swallowing. What we call dysphagia or dysphagia, difficulty in swallowing. You know, you and I we can swallow easily. Like there's no difficulty. It goes down smoothly. Now, at a point in time, someone who has developed a tumor there, you know, it is a lumen like this. The tumor can block the esophagus. Okay, it's a hollow kind of tube. It can block, it can be partial blockage. So that one, if you are swallowing, you'll be able to swallow, all right, especially light diet. You'll be able to swallow. But get tumor than it block the whole esophagus. It will be very difficult for you to swallow the food. Yeah. Yes, if the tumor has, it's big enough and it has blocked the whole esophagus, you won't be able to swallow, especially solid food. But with the partial one, you'll be able to swallow liquid because it will pass and not coincide, right? But you can't swallow solid food. And people sit at home because they feel like, so far as I've swallowed something, I mean, it will improve, but you don't take chances. You get it? So this is pertaining to that. Difficulty in swallow is one of them. There are other symptoms, signs and symptoms that we know, like weight loss. It happens to most cancers, and then few changes that you see in the body. But when you come to the throat, this is the specific one. Some people too, they vomit. Aside you losing weight, people, vomit and then all that. But with the throat, the specific one that is most common, we'll say that is difficulty in swallowing.
I want to know, at which point do somebody with difficulty in swallowing is in danger or feels he or she has esophageal cancer? Because for all I know, if you have common cold, catarrh, sore throat, sometimes it's very difficult for you to swallow. Sometimes you are hungry, you want to eat, but because you are finding it difficult to swallow, you cannot even eat. When you are swallowing, it's so difficult for you to swallow. So does it mean that if somebody has common cold, the person has sore throat and all of those things, the person cannot swallow, the person has esophageal cancer, or at which point if you have difficulty in swallowing, puts you in danger or feel like you have a cancer?
So I don't want us to be using cancer so that when somebody comes to swallow, no, yeah, I have cancer. I've experienced tonsillitis or sore throat before. I know how painful it is. But with this one, when you have swallowed, you feel like there's something there. How that feeling is. Now, when it gets to that point, you don't take chances. It is better to go to hospital and then let them tell you that you have sore throat.
Okay, so does it mean that it's like when you are swallowing something, let's say you try to swallow it, you still feel like there is a part of the food in the throat.
Yeah, exactly.
That
You
is
know how
now
that
starting
feeling
some
is.
fullness in your throat that
Aha.
has to come
Yes,
down.
exactly. When you start feeling that, sometimes, like I said, it's not all tumor that are cancerous. Some are benign. It means they are not harmful. They cannot spread. But if that benign state, you don't take it serious, and then it's progressed to the malignant. That is where the cancer comes in. So sometimes it's just a tumor that they can just take it off for you, okay? But if you sit at home and then it progresses to the malignant state, that's where the problem comes in. So we always preach for early detection, and this is one way where when you feel like you cannot swallow, now that you know that cancer can affect the throat, but the moment you realize that you cannot swallow, just go to the hospital. Let them tell you that it is sore throat for you to have your peace of mind. Let them tell you that, oh, it is a tumor, it's not dangerous. That one, you know that you're at a point of, surviving, even if it is about to. You get my point? So you should be worried at all time when you have issues, even if it is minor and you think that, oh, I can live with it. No, we don't take chances. You need to seek further, examination and then management. Yeah.
So I read somewhere that when you take very hot water, it puts you at risk. Let's say very hot food, like when you take very hot water, very hot food, it puts you at risk of having esophageal cancer. How true is that?
Well, I would say persistence of it is true, because if you keep doing it for the past year, we don't know when you look at the degrees above 65 degrees, what are you trying to do? Now, when you take fresh meat and you pour hot water on it, you see how the skin looks like. So imagine this throat with this tiny lining that is protecting the throat, and every obi to me no hot water, you could see there. Why? It's not a good thing, But we are not saying that, one time can cause cancer, no. It increase your risk, because the moment you keep drinking warm hot water, not even warm, hot water for a very long time, you irritate the lining. Now you expose them, and then the cells can damage. They can go to proliferation, the multiplication of it, and then you get a tumor again. But we are not saying that, oh, change now, hot here, but oh yeah, you irritate the lining. The moment you irritate the lining, you've exposed that part. Not only infections, but the cells can also grow abnormally. Yeah. So I would say no. It should be warm rather, or less than 60 degrees Celsius. Like it should be warm. We drink warm tea. We don't drink hot tea. So I don't think it's a good thing.
Okay. Viewers, you've heard all that Madam Elizabeth has said. I know you're learning something great from what Madam Elizabeth has said. Myself, I'm learning. Those who like taking very hot water. I know people who won't take tea without vapor. When they're coming to take tea, they would want to see the vapor coming out of it before they take it. And there are some people who wake up every morning to drink hot water, because they say when you wake up early morning, drink hot water with lime, it reduces your all of that. And people are constantly doing that. So today we are learning our lifestyle can put us at risk of having all of these signs and symptoms. So we'll go on a brief commercial break. When we come back, we'll discuss more about esophageal cancer. We'll be right back.
Okay, so
But before you talk about that, what are the diagnostic investigation, like the labs, the scans, the X-ray that you would do, maybe after the signs and symptoms we've talked about, when you go to the hospital and the doctor is suspecting an esophageal cancer, what are the diagnostic investigation that he'll take you through before we move to the treatment?
Okay, so with esophageal cancer, you know, with every cancer, we love to take biopsy. That will, you know, confirm that, oh yes, this particular tissue you brought is cancerous. Okay, so mostly they go in there, they take a little tissue of whatever is happening there, take it to pathology, to run some few tests, and then they know. Now there are other tests that we do. We will have something we call barium swallowing. It's like a dye. They'll give it to you, swallow, and then they visualize your throat. So if there's a changes anywhere, they're able to see with a dye. It's a white dye that they will give it to you to swallow. Then they will visualize that one. Aside the biopsy and then the barium swallowing, we have scans that you can do. You can do MRIs, X-rays. You know, that one too gives a picture of how your esophagus looks like. Okay, but the most important one that confirms that you have cancer of the esophagus is the biopsy. And it's not that feeling. I don't think anybody wants to go through that. They'll put something in your. I don't know whether you've had a feeling of endoscopy before. I have, and it's not easy.
I think my
And
mother has.
and it's the same process. They put something in there and then they take the tissue. So I don't think nobody wants to go through that process because it's not comfortable at all. So why don't you take care of yourself? So these are the diagnostic investigations that they will love to do. Aside that, they can run other labs to check your certain things in your blood to know that yes, this is where you're heading to. But the most important one is the biopsy they take, and then probably the barium swallowing. You can do the MRI and the X-ray. You know, for that one, it's just visual. It will visualize that part. But to confirm is the first two that I mentioned.
Okay. So, let's talk about the treatment. The treatment, how is it treated? Because if it is early, if the condition is detected early, how is it treated? And then if it is detected late, how is it treated? Like in general, what is the treatment for esophageal cancer?
Okay, there are a lot of treatment modality. And you know, one thing that we talk about is early detection. So depending on the stage you come with, like I said, I made mention that it's not all tumors that are cancerous. It can be benign. If it's just a tumor, they will take the lump off and then you're fine. And if it is even, it has gotten to the malignant state where we say the cancerous state. That one crampo is stages, you know, 0 to 4. Yeah. We have 5 stages. So imagine you come at stage 4. It has its own treatment. Imagine you come at stage 1. There are other treatments you can go through. So let's take it, the person has come with cancer. If it is not cancer, they just take the tumor out for you. They put on some medications and you're fine. For that one, I cannot mention the medication. No, we have specialists that work on that. But then what I know is that if you come and it is late, these are the treatments that are there that you can go to. It's either they will do surgery for you to take out the esophagus. Okay, they will just take it out because at that point where it has gotten to, nothing can be done about it. You can go to radiotherapy just like every other cancer patient go to. You can go to chemotherapy just like every other patient to go to. They can put you on other palliative therapy to make sure that you are comfortable. You are going through all that, but you are not in pain or you are not struggling. But the treatment will be smooth for you. Okay, so at the latter stage, and this is what happens. People even at the early stage, they can be on chemo or radiation therapy for some time, of which sometimes they get cured of it. Just like people with breast cancer who has been detected early, they survive. It's the same way. Cancer is cancer. The management it's kind of similar. It's the same thing that we do. But with the surgery, you know, if it is breast, we say you are going to do mastectomy, they are going to take. But with throat, it's called esophagectomy. So, you know, we'll show a video on that where they will do a surgery and then they will cut the esophagus. out and then they join your stomach to your throat. Look, who wants to go through that? So let's watch the video and then we see how uncomfortable it is. So yeah, these are the
So my
treatments.
viewers, if you are having all these signs and symptoms, I would beg you to go to the hospital, let the doctor check you and detect, let you do the biopsy and the other things until you have spoken about, so that you know what is going on. Don't just sit at home, because early detection saves life. Let's briefly watch the video on that.
Have you ever wondered how doctors replace a person's esophagus to let them eat normally again? This procedure is called an esophagectomy. It sounds a bit scary, but it's really important for treating esophageal cancer or severe damage to the esophagus. The surgery starts with general anesthesia, putting the patient into a deep sleep. Then the doctor makes a few small incisions in the neck or chest, and another opening in the abdomen to access the body. Using precise instruments, they carefully separate the damaged esophagus from the surrounding organs, avoiding the lungs and aorta while protecting important nerves and blood vessels. Once the damaged part of the esophagus is removed, the surgeon takes a section of the stomach, shapes it into a thin tube, almost like stretching it, and connects this tube to the throat. Sometimes, if the stomach isn't suitable, a section of the large intestine is used instead. This reopens the blocked passage, allowing food to flow smoothly into the stomach. Finally, the doctor checks for leaks at the connection and carefully stitches up all the wounds. After recovery, most patients can eat and speak normally.
I think nobody wants to go
No,
through this. So please, if you are going through any of the signs and symptoms our nurse has spoken to us about, I will plead on you to go and see your doctor so that you'll be checked and they will treat you as such. Until Lizzie, I want to find out, can herbal medication, herbal concoction cure esophageal cancer?
Well, we've had issues where people come to the hospital. Yeah, Miss Anna, na me no we be droby, and then they come and then they be a juno. Nothing can be done about it. You know, I don't know any. There's no evidence anywhere that shows that there's a particular herbal medication that treats cancer. Mind you, we don't even know the cause of it. We don't know. Whatever we are saying is secondary cause. So we don't even know the primary cause of cancer. So how then do you know that particular herb that you are using? So there's no evidence that shows that neem tree or whatever tree can treat a cancer. I don't know. But there's no evidence. So it is best to seek the right treatment. Okay, go to a hospital. This is what I'm feeling. And then if there is a treatment, they will tell you. But people try to seek other treatments first, the herbal treatments first, before they come to the hospital. By then, if there's any damage, it has caused already. So by the time you come, now you're worse. We don't want that. Just come, let's look at it. If it's treatable, we'll treat you. Then you move on. Herbal medication, ointments, they have their own roles that they play. But when it comes to conditions like this, you don't take chances at all. So there is no evidence. For me, I'm talking from what I know. Unless there are others. They can put it in the comment section for us to know. But I don't know any evidence that shows that this particular herbal medication or mixture can cure cancer.
Viewers, you've heard it all from our nurse. So please don't go taking any concoction in the name of treating cancer. Maybe you go to the hospital and the doctor checked you, you did diagnostic investigation, and then they found out that you have esophageal cancer or cancer of the. You are going to use concussions to cure the cancer. I beg you, if you do that, you may come with an end stage of cancer, as our nurse said. So we'll plead on you, if you have any of this condition, just go see your doctor. Let them treat you, because early detection saves life. Until is it? All too soon, we are bringing
Yeah.
our discussion to an end. But as Ghanaians as we are,
I know,
I want
right?
you to briefly educate us on our lifestyle, the food we eat, our general lifestyle to help us prevent esophageal cancer and basically other cancers.
Okay, so I think what I would talk about is the opposite of whatever I mentioned, like the risk factor. If you know you drink alcohol, it's either you reduce or you stop. Because you know how the akpeteshi and then the gin, those alcohol, you see how they are very strong. And then our throat, the esophagus, the lining is very thin. So imagine you are drinking alcohol all the time. You are irritating those lining off, and they are there to protect us. So if you drink alcohol, I will advise that you stop. Now, even esophageal cancer, we have two types. We have one that we call the squamous one, squamous cell carcinomas. That one is associated with to people who drink a lot of alcohol, like heavy. So that one affects the upper part of the esophagus. And then we have the adenocarcinoma. So that one affects the lower part. That one, people who have, at the lower, when we're watching the video, at the lower part of the esophagus, we have a sphincter. It connects directly to the stomach. So sometimes it gets weak or anything at all can happen. It opens. When the food gets to the stomach, it has to close.
Yeah.
Because we have acid in the stomach that can, reflux. We have GERD, people, so the acid can climb up. That can irritate the lining and can also increase your chance of you getting cancer. Okay, that one too is there. That one, we associate that cancer to people who have issues with their sphincter, the lower sphincter, where the stomach acid climbs up. But the upper one is mostly common because people abuse alcohol and then they smoke a lot. So why do you smoke the tobaccos and then the weed and all that? Those smokes, they irritate the lining. And it can increase your rates of infection, the cells can get damaged, and then with time, you can get cancer. If you don't exercise, lack of exercise, you have to start. Take a walk, 15 minutes, walk a day. Eat healthy diets. Because our diets can lead to we becoming obese. And lack of exercise. Obese can predispose you. So basically, that's all. I eat a lot of fruit and vegetables. I mean, it's there for us. Ghanaians is even cheaper. Somewhere advanced country, fruits are very expensive. So why are we not making good use of it? You get it? So we need to eat healthy, yes. The hot water thing we talked about, it should be less than 65 degrees Celsius. MOH, that is what they said we should do. It should be warm tea, hot tea. Some people will tell you that they are drinking it so that there are some germs or throat. They have to. People can get sore throat and they will be drinking hot water.
Yes,
you have issues in your throat and you are drinking hot water again. Look, come on. You are irritating the throat. So we need to take good care of ourselves. Yeah.
Thank you so much. So, my lovely viewers, you've heard all our nurse have said, and I know you've learned a lot of things from what she has said today, and you would go according to it and live well, eat well, exercise, and then if all the signs and symptoms she has spoken about, you experience some, just know that not all signs and symptoms mean that you have esophageal cancer. You have to go to your doctor, let him do diagnostic investigation, find out whether you have the condition or not. Then they'll treat you accordingly. So please, most important, see your doctor if you are going through any condition. The nurses and doctors are your friends. So please do not be afraid to go to the hospital and talk to them. Even if you're having difficulty or you don't understand anything, just go to any hospital, speak to a doctor for it, and we are always glad to help you to understand what is going on with you and treat you accordingly. Also soon, we brought our program to an end. We'll see you once again next week for another lovely topic and lovely experience. Thank you so much.